Welcome to Chronicles of What If. Today, we're tackling a thought-provoking scenario. What if the Biden administration had chosen not to push for the removal of anti-vaccine content on social media during the pandemic? With revelations about government pressure on tech giants like Facebook and statements from Mark Zuckerberg shedding light on this controversial topic, we're diving deep into how this decision could have reshaped public discourse, vaccine adoption, and trust in institutions. If you're fascinated by alternate realities and the ripple effects of pivotal decisions, hit that subscribe button and join us for this deep dive into what if. Let's get started. Imagine a world where the Biden administration chose not to remove or moderate anti-vaccine content on social media platforms during the height of the COVID-19 pandemic. This decision would have far-reaching implications, both for public health and societal discourse. Here's how this alternate scenario might unfold. 1. The public health impact. Lower vaccination rates. Without efforts to curb anti-vaccine rhetoric, misinformation could have spread unchecked, discouraging millions from getting vaccinated. This might have led to lower vaccination rates, prolonging the pandemic and overwhelming healthcare systems further. Increased mortality and morbidity. Misleading claims about vaccine safety and effectiveness would have likely caused more people to avoid vaccination, resulting in higher infection rates and preventable deaths. Delayed herd immunity. Without widespread vaccination, achieving herd immunity would have taken significantly longer, extending restrictions, lockdowns, and economic disruptions. Erosion of public trust in science. A lack of intervention to counter misinformation could have further eroded trust in scientific authorities and public health organizations, making future health crises even harder to manage. Heightened division among communities. Misinformation often polarizes society. The unchecked spread of anti-vaccine content might have amplified divisions between vaccinated and unvaccinated groups, fueling social tension and mistrust. 2. Social media's role echo chambers. Flourish. Without moderation, social media platforms would have become echo chambers for anti-vaccine sentiments, amplifying conspiracy theories and eroding trust in public health authorities. Algorithmic amplification. Algorithms designed to promote engaging content might have prioritized sensationalist anti-vaccine posts, making them even more visible and influential. Misinformation as a global issue. Unchecked anti-vaccine rhetoric in the U.S. could have spread globally, particularly to countries relying on American platforms, complicating global vaccination efforts. The role of Zuckerberg and big tech. Mark Zuckerberg and other social media leaders would have faced unprecedented scrutiny for their platform's role in spreading harmful misinformation. While Zuckerberg has publicly stated Facebook's commitment to combating COVID-19 misinformation, in this scenario, the lack of moderation might have amplified calls for him and other CEOs to take responsibility. Pressure from lawmakers, public health officials, and advocacy groups could have mounted, leading to heated debates over whether big tech prioritizes profit over public safety. 3. Political and legal fallout, free speech versus public health. The decision not to moderate anti-vaccine content might have been framed as a defense of free speech. However, this would have sparked fierce debates over the balance between individual rights and collective safety. Increased pressure on tech companies. Tech companies like Facebook, Twitter, and YouTube could have faced backlash for allowing misinformation to thrive, prompting calls for stricter regulations on their role in public health crises. Partisan divide. The lack of action might have further polarized the political landscape, with one side championing freedom of expression and the other accusing the administration and big tech of negligence in protecting public health. Looming regulation threats. Zuckerberg and other tech leaders might have been summoned to congressional hearings, accused of enabling a misinformation pandemic. This could have led to bipartisan support for regulating social media platforms more strictly, marking a turning point in tech policy. Declining public confidence in leadership. The administration's perceived inaction could have eroded public confidence in leadership during a health crisis, leading to increased political unrest and diminishing trust in government institutions. International criticism and comparison. Other nations that actively fought misinformation might have criticized the U.S. approach, positioning their strategies as more effective in managing the pandemic, potentially damaging America's global reputation. 4. Economic consequences. Extended economic disruption. Prolonged waves of infection would have delayed the recovery of industries reliant on physical interactions, such as hospitality, travel, and entertainment. Increased healthcare costs. Treating more severe COVID-19 cases due to lower vaccination rates would have strained healthcare systems and budgets, both public and private. Worker shortages. High infection rates and long-term COVID impacts could have worsened labor shortages, further disrupting supply chains and economic recovery. Decline in consumer confidence. Persistent uncertainty around the pandemic and misinformation about vaccines could have weakened consumer confidence, leading to reduced spending and slower economic growth. Higher business failures. Small and medium-sized enterprises, especially those in sectors heavily impacted by the pandemic, might have faced higher rates of closure due to extended lockdowns and reduced customer activity. 5. Long-term societal effects. Erosion of trust. The proliferation of unchecked misinformation might have led to an even greater erosion of trust in science, government, and media, with long-term implications for future public health initiatives. Normalization of misinformation. Allowing anti-vaccine rhetoric to persist without challenge could normalize misinformation as a legitimate perspective, making it harder to combat in future crises. Strengthened anti-establishment movements. The lack of moderation might have emboldened anti-establishment groups, leading to a stronger and more organized opposition to government interventions in health and other sectors. Fractured social cohesion. Persistent misinformation and its divisive effects could have further fractured societies, deepening divisions between communities based on their beliefs about science, health, and governance, undermining future public health efforts. A precedent of tolerating widespread misinformation could undermine future public health campaigns, as skepticism toward official guidance might become more ingrained, complicating efforts to address new health crises. 6. The Zuckerberg dilemma. Mark Zuckerberg, often seen as a symbol of big tech's dominance, would have faced an intensified moral and strategic dilemma in this alternate reality. Corporate responsibility versus profitability. While refusing to moderate misinformation could protect Facebook's engagement metrics, it would also position Zuckerberg as a figure complicit in spreading harmful narratives. Public trust in Facebook, and by extension its parent company Meta, might have plummeted. Public outrage. Advocacy groups and public health experts might have rallied against Zuckerberg specifically, accusing him of prioritizing ad revenue over lives. Protest movements, boycotts, and viral hashtags like Zuckharm might have emerged. Calls for breakups and oversight. The inaction on misinformation could have strengthened calls to break up big tech monopolies, with Zuckerberg and other CEOs becoming focal points in the fight for stricter regulations. Comparing realities. In our timeline, efforts to moderate anti-vaccine content, though controversial, likely helped mitigate some of the most extreme impacts of misinformation. However, these actions have sparked debates about censorship, government overreach, and the role of tech companies in public discourse. In the alternate reality where no action was taken, the immediate health and societal impacts might have been worse, but the long-term effects on free speech and public trust could have been less contentious. The trade-offs in either scenario highlight the complex balance between individual rights and collective responsibility during crises. What do you think? Should platforms like Facebook prioritize public health over unrestricted speech, or is free expression worth the risks of misinformation?